Hello everyone. Welcome to Beach World tonight. I'm Lexus Chen. Thank you so much for joining today's sharing. So before starting today's sharing, I want to share with you for some information. Some of you may like to watch movie, watch TV, and also watch the sport games. Yeah, you will always find some movie stars, they're already 50 years old, but they still looks like 40 and even 30 years old. Yeah, they are so handsome and so beautiful on their appearance. And some of the sport game player, for example, the basketball player and also the football player, they're already 30 and 40 years old. But on the playground, since they still act and perform like a 20 years young player. So it's amazing. It looks they never get old. So what we find is they really care about their body health and also their body performance. Yeah. So I would like to ask you some of the questions. Okay. Do you want the cells of your body, which is 5 to 20 years younger? And also, do you want to seem 5 to 10 years younger than your actual age? And do you want your liver, your blood, and colon to be clean and healthy? And do you want to have a strong immune system right now? And the last one, do you want to have an ideal weight of your body? I believe you want them all. But in the modern lifestyle, you need to deal with a lot of problems. For example, the first, safety of the food, such as toxic chemical applied on the food. And second, it's environment pollution, such as water pollution, air pollution, and the soil pollution. And also the next one is bad habit. Some of you may have habit of smoking, alcohol consumption, and also overeating. And the next one is about you may face stress, the stress from your work, your family, the relationship, and also the money. And the last one also it's about your lifestyle. Some of you may lack of sleep and exercise. So if you continue in these manners, you might get premature aging and eventually you get disease and eventually kill you. So as we know, more and more of the people, especially young people, they start to talk about anti-aging. So it's a trend. And what can we do for the anti-aging? So today it's our honor to invite an expert from Australia who have more than 30 years experience on anti-aging researching. And this gentleman is also one of the member of Biswell Smart Lab panel. So let's welcome Dr. Fernando Cortizo. Hello, Doctor.
Hi, how are you?
Yeah, fine. How are you,
Doctor? Great to be here tonight.
Yeah, it's our honor and so great you can join our sharing tonight. So you are an expert and you will share the anti-aging and also the next generation anti-aging tonight. So I think all of our audience, you may have a lot of questions during tonight's sharing. No problem. Just leave your question, leave the message on YouTube Live on the chat. Then we will pick some of the question and after Dr. Fernando sharing, we will have a question and answer session. So we will pick the question and let Dr. Fernando to share the answer for us. So Dr. Fernando, please start your sharing tonight.
Thank you. Welcome everyone. Thank you so much for giving me the chance to talk to you again about this very important topic, which is something that we have been covering for a number of weeks now. If you recall, we start our program talking about the question of aging, and we decided then many weeks ago that aging is a universal phenomenon. Okay, so it's a phenomenon that actually afflicts and affects everyone. From the moment you're born, you begin the process of aging and dying, and slowly, without any ability for us to control it, the process will come to a certain point, which it would actually mean our old age and eventually our mortality as well. So aging is part of life. However, we try to decide whether we can actually control the aging process. Can we slow it down? Can we do something about the aging process to make sure that we can actually contain it? And more importantly, is can we do certain things to be able to have full quality of life until the very, very end, which would be ideal for us. I'm sure you agree with that. We would like to have a full life, full of quality until the very end. And that's essentially our goal. Now, remember that we identified several causative agents of aging, and we said that there were a number of issues. Some of them are genetic, some of them have to do with the aging of the body and the decay of the body. We talked about so many different possibilities. We talked about free radical damage, cell damage, and so on. But we managed to identify three major causes of aging, which are, in fact, very simple. The first one is the loss of the ability to detoxify by the body. And remember that this is a very important issue which actually triggers and advances the aging process. Then the loss of energy production. In other words, the loss of our fuel for energy and function appears to decline as we get older, very, very, very consistently. And then finally, we identify that the loss of muscle mass in the body is one of the preludes to the aging process, and also the prelude to morbidity, disease, and mortality as well. Now, today I want to talk to you about another very important issue, which is should young people actually start doing anti-aging, okay? Should really the young person be worried and being concerned about aging? Now, I'm going to cover this topic, but also cover with you more in depth. And so I'm sorry if you find some of the information perhaps perplexing or complex, but I'm very happy to discuss that with you later on again and again until we have that clear in mind. Remember, this is research that I'm presenting to you. In no way do we intend to provide you with actually a medical advice. And remember that that's essentially an important premise of our presentation, that we are here to share with you this information. And we're here with you to provide you with information which you are going to use yourself in your daily life to be able to make important decisions. Okay, so remember that often people ask me this question very, very clearly, and it's a very pertinent, very important question. I'm 20 years old. Should I worry about aging? What do I have to do if I am actually young, right? Why don't you let me live my life free of concerns? I want to enjoy myself. I don't want to worry about aging because I'm 20 years old. Often we hear that, okay? And then I would say that in my answer is that anti-aging is for both, for the young and the old. But fundamentally is for the young. The young people are in fact more in a position to do something about the aging process for the present, the near future, and the far, far, far future as well, which I'm going to discuss with you in a moment. Now, remember, no medical claims. We don't intend to provide you with medical advice. If you have any medical issues, please search and seek for the medical advice from your family doctor or medical practitioner. Okay, so we just want to provide you with scientific research and information for information purposes only. Now, the important question that we often hear is aging actually a disease? And I would say that often people equate aging to a disease. They say the aging is very similar to a disease. It developed the same way. But I would say to you that this is not a disease, okay? In fact, what we know is that aging is a major risk factor. In other words, if there are risk factors associated with diseases, for example, occupation, lifestyle risk factors, family obesity, family heart disease, I'm living near a factory, and so on. If there are any major risk factors associated, with the aging process, I would say to you clearly that aging is in fact not a disease, but is a major risk factor for the development of chronic disease. I know you're going to think about this in a very strange way, and you're going to say, what does that mean? It means that first came aging, and then came the chronic disease, okay? So that aging is a risk factor. It starts developing the risk factors for the development of chronic diseases, okay? At the same time, we see the paradox that many diseases appear to accelerate the aging process. So in other words, not only do you have aging as a major risk factor, which will lead to chronic diseases, but also that many diseases seem to accelerate. Once they set in, they will accelerate the aging process, okay? And it will show itself in a particular way as a declining function, a reduced quality of life. So this is what we see in terms of aging. It is an increasing loss of functionality and reduced quality of life. Now, this question is very important. As I said before, often I get asked this question, and there's a lot of controversy about this. But let me explain to you why I think the young people should do anti-aging. And then you're going to ask me, how young is young? And I will say to you that, of course, the legal age to do anything is, in most countries, 18, 19, 20, 21 in some places. For example, in America, to be able to drink, you have to be 21. Okay, so around that age, you can make your own decisions. But if you want to do anti-aging, you can start anytime in your life. The earlier, the better. And there are two main reasons for this. It's very important that you follow through with this, because it's going to open up many interesting doors in the knowledge of this process of aging, which you probably have never heard before. And then you're going to find this somewhat perplexing and very interesting as well. Now, the two main reasons why I think young people should actually do anti-aging. The first one is because early life sets the stage for your aging. Your early life events develop the stage, set up the stage for your aging, for your diseases in the future, and longevity, for you. So you are actually responsible in many respects for the decisions that you make. And you will set up with your lifestyle, with your decisions, set the stage for your aging in the future. If you find yourself, remember this, if you find yourself in a wheelchair, suffering chronic disease, suffering from some form of disease, it was you who made the decision. You cannot really blame anyone, unless, of course, you're the victim of chemical or radioactive fallout, something of that nature, which you have no control of. But in general, in a normal lifestyle, you are the key. You make the decisions, okay? So you're gonna jump in straight away and say to me, hey, Doc, what about genetics? I have no control. I will explain to you in a minute. The second point is why you should start aging early is because your early life sets the stage for aging and disease of your future generations. Your children, your grandchildren, and your great-grandchildren, and so on, them. Your lifestyle, your early life sets of events will influence profoundly the development of disease, longevity, and these questions for your children and future generations. Which in effect, it means that we are here responsible principally in this time and age for what happens in the future. And at the same time, we are suffering from the things and the decisions made by people before us. Now, that's extremely exciting that we learn is that, in fact, parents, by making certain types of decisions, lifestyle decisions, will actually encode those decisions in their genes in a particular way, and they will actually revisit the future generations. Sometimes the children, grandchildren, or great-great-great-grandchildren, they will suffer the consequences of some of the decisions that we make today. We said before, early life sets the stage for aging. So whatever you do in your own life, in the end, it means that whatever happens in the early stages of your life will have a significant impact in your old age. When you are young, for example, you can enter into specifics behaviors like smoking, obesity, no exercise, no sleep. Okay, many of the things that we do when we are young, eating too much sugar, other things as well, eating unhealthy food, and no proper diet, no antioxidants in our diet, no fruit in our diets, no protein in our diet, and so on and so on. And we know that this leads to specific diseases during old age. And then we can name some of those, for example, such as diabetes, as you know, comes about because of obesity, the wrong food, eating frequently, too much sugar, etc., etc., etc. Right? No exercise. Heart disease is said about, as you remember from our last presentation, heart disease occurs because of the development of hyperinsulinemia, or high insulin, caused by lifestyles, no exercise, too much fat in the body, yes? And accelerated aging, which is a consequence of what we are actually doing during our youth. So whatever you do in the early stages of your life, you will eventually pay the price, okay? This is just between you and you alone, okay? So the next thing is, what happens with them? What happens with our children, grandchildren, great-grandchildren? And let me just explain to you this slide, which is actually very simple to follow, very easy to understand. And I want you to try to memorize some of this information, which will become available to you if you need it, whenever you want it, okay? The early stages of your life sets the stage. It predetermines the future for them. And who is them? Is this the future generations, okay? What you do while you are young will affect your future generations. It's not that you will die and people will forget what you did and they will embark in a healthy lifestyle. It doesn't work like that, okay? What we know is that our actions during our youth will affect not just our old age, but also our entire family and our entire descendants. And often, I have to tell you, that it also affects people that are not directly related to us by DNA, not directly biologically related to us. And I will discuss that at a different stage. So smoking, obesity, no exercise, no sleep will lead to diseases, not just for yourself, but also for your future family. And how does this happen? Because people say to me, hang on a minute, Doc, I thought that DNA would encode, the DNA structure would encode all the information that I actually am processing, that I'm using for the future, right? How is it that my actions while I'm young will affect future generations? And I will tell you how this happens. This happens simply because any form of information in the DNA, okay? And let me remind you that DNA doesn't necessarily ensure that you will develop certain diseases and lifestyles. DNA is a set of information that by and large, remains unchanged for the rest of your life, for you until the end of your life, and for your children until the end of their lives, and for the great-grandchildren, and so on. So DNA in itself, while it will provide you with certain susceptibilities, in other words, it will make you sensitive to certain things, right? It's not consistent and strong enough to be able to determine specific diseases. Unless, of course, we're talking about a mutation, in which case there are examples, which I'm not going to cover here, of mutations or diseases that are driven and not specifically determined by certain structures of DNA or mutations in DNA. But in general, for a normal person, I will tell you that from the moment you are born until the moment you die, your DNA does not change, unless you've entered into a particular research program in which people are injecting you with sequences of DNA to change your DNA, which is not going to happen, right? And I'm not going to talk about things that are happening today because it seems to be irrelevant. But however, I will say that your DNA will remain the same DNA until you die, until your children die, until your great-grandchildren die. So DNA remains. But what changes is what we call epigenetics. Now, I want you to learn this information because it's very important. So what is epigenetics? Epigenetics, I often equate it to the information that you have in your DNA, which is very much like your hard disk. DNA is like your hard disk, and epigenetic is your operating system or the program that is pulling the information from DNA. So what we know now is that from when you're born, your epigenetics is what, let's say, is A. By the time you die, or when you get to old age, your epigenetics has in fact changed. The way you process information from DNA has actually changed. And during your lifespan, your body and your lifestyle has actually influenced the DNA to actually release information in a different way. I know this is very, it's a lot to digest, but what I'm trying to tell you is that while DNA, like the hard disk in your computer, okay, has a specific structures, memory, set of information that won't change or will not likely change. But epigenetics, which is in fact the interface between your DNA and life, biology, life actions, epigenetics will change. And then when you bring certain experiences to young people, it's very, very interesting because people have done experiments regarding this issue where they subject young people to certain experiences. And I'm telling you, this is real research, where they subject young people to awful situations. And I remember very early days, I'm not going to mention them here, but if you're interested, I will let you know the details, where they actually raise certain animals like monkeys and baboons in isolation, where no one will touch them. No one will actually, they will have no physical contact with anyone. And then when they analyze these animals for the beginning until the end, and they look at their DNA and they look at their life styles and they look at how they behave, they found that touching of the skin in the early days of a baby, touching between mom and the baby, has a profound effect in the way the DNA actually reveals itself and unravels itself. And the information that comes from this DNA, if you have a good maternal skin contact, it will lead to good health and will lead to a happy child. But if you have no skin contact with mom while you are developing as an infant, the consequences is that you become criminally inclined to criminality, violence, and antisocial behavior. Now, these experiments were done with animals. And let me tell you that in some parts of Russia, I remember that in orphanages, they did a similar experiments where they actually looked at the children. They had essentially no mother or father contact. They were alone. And then they reveal similar changes in the DNA structure. So what I'm trying to tell you is what you do to a young person. In other words, what the young person is subject to in the early days of their life, whether they are willing or unwilling, it doesn't make a difference. It will have an impact on the way the DNA information expresses itself, and it will define what type of epigenetics you're going to develop. And it will decide whether you will have good health, bad health, or average health, or that you will have disease or certain types, yes or no. So very interesting information. It's very exciting because it has significant implications. We'll discuss this a little bit more in a minute. So what we're saying here is that your early life sets the stage for them, for yourself, your family, your children, grandchildren, great-grandchildren, and so on. Your DNA does not change. However, what changes is how your DNA is regulated, how your DNA is performed during the request for information. Your DNA might become more activated to produce pro-inflammatory things, pro-inflammatory molecules, molecules that actually cause certain types of conditions to appear, okay? And we call this, as I said before, and this is a summary for you, epigenetic changes. It is very much like a change in your personal computer program, right? Now, just to show you this, and I'm not going to spend a lot of time, so I don't want you to worry a great deal about the amount of information, is that, for example, what happens to people with cognitive behavior? And you know that when we age, we lose memory, right? We lose concentration, we lose the capacity to perform certain mental challenges, okay? And so what we know is that that the brain is born in a specific manner. And I have to tell you that if you want to do the research yourself, please do that. I know people find this controversial, but I'm more interested in the truth rather than the controversy. The truth is that the brain is born in a particular way. When you're born, the brain has a certain mass, structure, thickness of the cortex of the brain. It has a certain defined structure in itself, certain weight, certain form morphology or form definition. And so things that happens early in your life will actually affect your brain. Your genes would also define how this brain will develop. And what we know is that if you were, if you had high Q or you were intelligent, or you were very young, most likely as you get older, regardless of what happens, you will retain some of that level of intelligence. But also it says something else too, is that if your brain capacity is less than what we think to be very high, there are certain things that will change your intelligence, and it will change the function of the brain. For example, like behavioral things, like economic possibilities, education, advantages, right? Going to school, going to university, having parents that are interested in the development of your education or teaching you things, right? Your cognitive ability, that is your ability to understand and make sense of complex things, will actually improve. But as you get older, your brain, which was born with a certain capacity, and then as acquired through education and lifestyle, and maybe being born in a rich family or being born in a country that has food and has everything at hand, it will improve because there are certain things that are actually provided for the performance of the brain. However, what we find is as we get older, all of that diminishes, okay? We lose our our advantages in many respects. So the body and the brain have to go back into what we call the brain reserve. And the brain reserve is in fact the certain spare memory, if you want, of the computer that allows your brain to continue to perform, although the majority of the computer system is now failing, okay? So the brain reserve that is there allows for at least remain a fraction of that cognitive ability, of that intelligence to remain as we get towards old age. And so we end up through aging having either very low cognitive, which is loss of memory and loss of everything, interpretation, cognition, memory, and so on, or we have a very high level of those cognitive functions, of the function of the brain. And often what we understand in this particular part of the body function is that early life exposures, and remember this, early life exposures can change the limitations of your genes, okay? So that even if the genes provide you with a superior brain, if you're born in a system that provides you no education, no parental love and control and support, and no social support, your brain development will suffer. So in other words, the genes don't actually account for everything. Often it is behavioral, it is educational, it is economic, and it's also lifestyle, the things that determine the final outcome of the functions of your body, okay? Now, often what we try to do is to say, okay, so how are we going to study this? And I want to lead now into the process of understanding what can we do about this? What can we do about the effects of the limitations of the genetic material in our bodies, the changes in our genes? What can we do, right? How can we change our aging process? Can we change it? So often it's better to try to understand the changes in old age rather than the biology of the disease. So I tell people, don't focus on particular diseases, let's focus in old age. Why do we age? And that's important to give us an indication of what we can do for the future in order to reverse it, push it back, or delay it. Okay, so for example, sometimes, when we get a bacterial infection, we get an infection and a wound or a cut and so on, inflammation for the body, and you see that when you cut yourself, you get an inflammation, it gets red, and it gets swollen and inflamed. Now that's part of the healing process, okay? So the inflammation that you see during recovery of a wound is in fact a healing process. But however, what we see in our bodies is a consistently low level of chronic inflammation. Okay, the same inflammation that is part of the healing process can actually happen slowly during aging. Okay, and now I know a lot of people that suffer from chronic inflammatory disease, and often chronic inflammatory disease happens because of lifestyles, right? They smoke, 100%. I'll tell you, if you smoke, you have high chronic inflammatory disease. They actually eat food, a lot of fried foods, which fatty acids that are not adequate, right? And you don't have enough omega-3, sometimes in your diet, but you use a lot of fried foods, a lot of oil in your food. So leading to chronic inflammatory disease. When you are into a Western diet, there's a lot of omega-6, okay? And that increases chronic inflammation. Now, during this aging process, chronic inflammation increases during old age and increases the frequency of diseases during old age. So this inflammatory disease that was part of the healing process now becomes one of the major causes of your diseases in the future, okay? So chronic inflammatory disease, chronic inflammation also can contribute to frailty, in other words, to weaknesses when you become older in ways that are independent of what we can consider to be a disease, which means essentially chronic inflammation will contribute to your aging and will contribute to your weaknesses and loss of muscle mass as you get older, okay? Now, remember, this is very important to understand this concept that longevity can be inherited across many generations, okay? Through what we call epigenetic changes. So longevity can be inherited, right? So the fact that you today, at your age, are trying to change the way your outcome is going to be by doing anti-aging, you will actually instigate, you will program epigenetic changes in your DNA that not only are they going to benefit you at the end of your life today, but it's going to benefit your children and the children of your children and your great-grandchildren, okay? Now, this is why often people ask me, what is it? For example, in the United States, we see people who are very obese, very big, eating all the time, watching TV all the time, becoming very big, and then suddenly the children are exactly the same. The children become also the same, right? Now, did they inherit that? I'll tell you what they inherited. Their DNA, their genes did not have, they were not coding for you to become fat, become obese, or to become sick. What they inherited is these epigenetic changes, this performance, lifestyle performance and programming, which is part of the DNA, which actually leads to obesity and the same outcome as their parents, okay? So these epigenetic changes are changes that affect the DNA behavior. It does not alter the sequence of DNA, okay? So what this is telling you is that parental lifespan, the lifespan of your parents, for example, and even the behavior of your parents, remember you're going to become one too, can influence the lifespan and the health spans of the next generation. Now, the lifespan is how long you live, right? How many years you live. But what's the health span? What does that mean? Health span actually means the period of your life in which you are disease-free. So the period of your life that actually has less diseases, okay? So what we see is that parental lifespan and parental behavior will influence the lifespan of the children and the health span. So they will influence how long the children will live and how healthy the children are going to be and for how long they're going to be healthy through the genetic mechanism. So remember this, that anything that you do that extends your lifespan, it also extends your health span. This is very important. So whatever you do to extend your lifespan, to live longer, it's also going to result in a healthier lifespan for you and your children and the children of your children. Now, what can we do? about the aging process. And then we will finish this part very shortly. Give me a few more minutes. And I need to explain to you that there are three basic horses of the apocalypse, as I call them. These are some of the major issues that we began to understand in the research that has been done in the last 20 or 30 years, okay? So what can we do to help us to slow down aging? Now, one of the things we know we have to do, that we actually do in many different ways, and we do in ways that we don't really understand often what we are doing, is to remove what we call old cells. And these cells are called senescent cells. Now, the senescent cells from the body are unique in that they are normal cells. They are not cancer cells, but they are the cells in your body that they eventually stop multiplying. They don't multiply anymore, okay? They don't multiply anymore. They stop multiplying, but they don't die when they should. So essentially, your ghosts, they're ghost cells walking around, right? They are not cancer cells, okay? Just remember what I'm saying. They are not cancer cells, but they're walking around and they don't die when they should die, okay? What they do, though, is the senescent cells, we have begun to understand and think about this process, that your skin is full of senescent cells, which are actually stop multiplying. They're not multiplying anymore. Therefore, the cells are becoming old, inoperable. In other words, they have no capacity to operate. And these cells, in fact, we think that create things like aging of the skin. They create the wrinkles in your skin, okay? So these senescent cells will remain and continue to release chemicals. One of the things they do is that while they don't grow, they will produce chemicals which consistently cause inflammation to other normal cells around your body. So one of the things we need to do is to remove all cells. And I will tell you how we can do this. But to remove all cells, of course, one of the things we need to do is to have proper detoxification in the body, and we have to have enough energy so that the body, with that energy, causes these cells to die. Okay, this is very interesting because this is the frontiers of anti-aging research have now come to fruition, and now we're beginning to understand how things happen and why they happen. But funny enough, that this has actually confirmed for me, in my mind, for a long time now, that detoxification is critical for the destruction of senescent cells, okay? Now, what you see here is what happens. This is just a normal cell, you see here on the left, and then through bad nutrition, high toxicity, low energy production from the mitochondria, which are these yellow structures in here, which produce the energy for the cells to function properly, stress, damage, that can be burning, cigarettes, pollution, etc., 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 etc. Okay, it causes what we call the senescent cells. So the normal cells leads to senescent cells, which now they stop multiplying, so they don't regenerate. They don't replace themselves. They don't create children's cells to replace the old cells, which eventually die, and they stop dying. In other words, that they get incorporated in our body and they remain old, with an old function. And what they do at the same time is they continue to produce, and this is demonstrated, I will show you that some of the research has been done, molecules that trigger inflammation, leading to chronic inflammation, disease, and aging. Right? Again, it's the same process that I described for you before. What you want to do to control aging is you need to destroy and remove senescent cells from your body, okay? So how senescent cells affect your body? Already talked about this in detail, but the number of senescent cells in your body, in aging body, increases with time, okay? The immune system becomes less effective. Senescent cells accumulate and affect the healthy cells. This is true. I will show you some of the research. So your ability to withstand stress, illness, to recuperate from injuries, to learn new things, and so on, will actually go down. Your ability to live healthy life will actually go down, since these senescent cells in the brain can degrade your cognitive function, can affect your brain functions as well. Because as your brain becomes loaded with senescent cells, which are aging cells, then that don't get replaced, they don't get removed, then your cognitive and brain functions decreases, okay? So this senescence of the cells is connected to many aging diseases, okay? Like cancers, diabetes, osteoporosis, cardiovascular disease, strokes, Alzheimer's, osteoarthritis, and so on and so on. And some of the research seems to show clearly that senescent skin cells contribute to the sagging and wrinkling of the skin, okay? So removing the senescent cells is an essential part of staying young. What do you need for that? You need excessive amount of energy produced by the mitochondria, and you need detoxification procedures ability in your body. Now, this is one of the important research that has been papers that had been published recently. This goes back to 2016, 2017, published in the NCBIA, in the United States government research references database, and it says this: how do you remove senescent cells? And they found out that by doing a diet-induced weight loss, now listen carefully to my words, by doing a diet-induced weight loss, okay, is sufficient to reduce senescent cells numbers in the fat tissue of mice. Now, this research has been moved on to humans as well. But the early research that actually was carried out, it showed in vivo that when you produce a diet-induced weight loss, and here I'm thinking about iSolution program, of course, diet-induced weight loss is sufficient, according to the researchers, to reduce senescent cells. So there you go. If you want to reduce senescent cells, you go into a diet-induced weight loss program. And I will tell you how the program is. If you're interested in reading this, I can post the link for the research so you can do it yourself, okay? Now, what else can we do? And this is research that has been done for the last 50 years at least. And a lot of this research is really, really amazing research. And let me tell you that it is incredible in that it shows what you can effectively do to extend your life and improve health, right? This is called caloric restriction. Now, this research program have been taken to an extreme, and I don't suggest that you follow this. I don't suggest that you follow this program, which actually means that you're going to take 500 calories per day. This is a near starvation program. In other words, you're going to be starving. You're going to be miserable. You're going to be really unhappy because you're only going to take 500 calories a day, which is not very much. 500 calories is very small. Now, when some of these volunteers to go into this program to show people what happens when you cut calories, in fact, their life span is extended and their health is improved. They look terrible. They look skinny. They have very little fat, okay? But they're going to live a long time and have very good health. Now, I don't suggest you do this. I suggest that you have to find a way halfway this process whereby you do some form of caloric restriction, but you don't push it to the extreme, okay? This is almost a near starvation program, which has amazing properties. Really, it's extremely good for you, but it's terrible if you really want to carry it through in your life. It's almost impossible. It's very difficult, okay? You have to have a super self-control and determination to be able to run through with 500 calories a day. But people who have done this have shown that when you reduce calories, you increase lifespan and you improve health. Your appearance is not going to look that good, but in terms of your health, you certainly will be a lot better. They are even trying to use caloric restrictions together with chemotherapy because it seems to help the outcome of cancer patients by reducing some of the side effects as well, okay? Now, what else can you do to slow down aging, okay? We said before, reduce senescent cells, all right? It's very important. Caloric restrictions has been demonstrated to have amazing impact. And the other important aspect is how to improve genetic expression through healthy diet, exercise, good nutrition, and reduce calories. Remember that we said that epigenetic changes are the ones that seems to lead to the transmissibility through the inheritance of disease, obesity, and other bad outcomes, okay? So longevity can be inherited across generations through epigenetic changes, okay? The changes affect gene behavior, but they don't alter the sequence of the DNA. So now, in other words, our hard drive is still the same. And it suggests that parental lifespan and parental behavior will actually have an impact on our lifespan and health span and our health. You can improve genetic expression and epigenetics through healthy diet, exercise, very, very important, good nutrition, and some amount of reduction of calories, okay? Now, I'm sorry if I've taken so long. So 3 things, summary of current scientific research. These are the 3 areas that had been absolutely researched to extinction. And so we now know removing senescent cells, diet and exercise induce weight loss. That's how you do it. Diet and exercise induce weight loss. Also, you can add to this detoxification profiles improve, okay? Caloric restrictions that induce control of calories, also shown with research and many programs around the world to have an important effect on aging. Now, to protect genetic expression and epigenetics, good lifestyle, exercise, nutrition, and good detoxification. All of these programs, may I add, are included in the iSolution program to help you deal with detoxification, low energy, and low muscle mass. In fact, I find the iSolution program, we have discussed this other times, it makes you look great, lose weight. We use 2 amazing products, dietary fruit juice and dietary milkshake, which actually, in combination, working together, they improve detoxification, they improve energy in the body as well, among many other benefits. The dietary milkshake provides a significant amount of protein, healthy proteins, to allow for a development of muscle mass, okay? Together with the dietary fruit juice allows for us to deal with the 3 different causes of aging. We know that using the dietary milkshake, we have a very healthy food substitution and significant amount of protein with very low calories. Now, these products are in fact low glycemic index. They're actually free from gluten, and they do an amazing job in trying to support you to overcome the challenges of aging. Now, we promote always the 14 days iSolution program. Remember, we said before that how you want to remove senescent cells, how do you want to control calories, okay? We do it by having a program like this, which combined with moderate exercise, it means 14 days of a lower calorie, not low calorie of 500, but around 800 to 1,000 calories, substituting breakfast. Then for the snacks, mid-morning, you use dietary fruit juice, a control meal at lunchtime, and then for afternoon break, you use dietary fruit juice, and then dietary milkshake for dinner. And you do this for 2 weeks. I'm not asking you to do it for 2 years. It's only for 2 weeks. The iSolution maintenance, after that, you can have a maintenance program, which is around the 2,000 calories, which includes certain meals and certain substitutions with the dietary fruit juice in the morning or afternoon breaks to avoid overeating and munching, with good a good lunch and also dinner as well. Now, remember, the iSolution program will help you to lose fat and shape up. It will help you to deal with aging, the causes of aging, that actually, in fact, detoxification loss. It will improve your internal energy and improve your muscles, mobility, and strength. And effectively, it will help you to deal with the 3 major causes that we discussed today, which contribute to the aging process. Okay. Thank you, Mr. Chen.
Yeah, thank you, Dr. Fernando, for your sharing. So I think all of our audience already know the course and know what is important for you, for your body health. You need to start to pay more attention. Yeah, and also the young age people, you need to start to take care of your body. Okay, so Dr. Fernando, I already received some of the questions on our
Right.
YouTube. So if any of our audience you still have question, please keep leaving message there. Then now let me pick some of the questions for Dr. Fernando to answer first. Okay, so first question, Doctor. Okay, so the question is, should I start anti-aging in young age, and how old will be the best to start? So as you mentioned, it's from 18, right?
Right. Well, you can start 18, but I said I would say that you can start as early as you want, because really you're not going to do anything that's going to jeopardize your health. You're doing things, in fact, to improve your health and to improve the final outcome of your aging, right? So it's not that you're going to have some medical procedure that needs mom and dad's approval, of course. But of course, it's very important to talk to your family. If you're younger than 18, discuss with your parents, make sure they're happy with that, and then discuss with anyone that associated with you, your doctor, or your, if you're young of the age where you cannot make these type of decisions often, then get some advice. But I think that you're not going to have any problems. You start as early as you can. It's like an insurance, right? You start as early as you can. Start saving your health as early as you can, and you're going to end up with a very, very good outcome, very good outcome in the later time in your life.
Okay, doctor. So some extension about this question. So if some I have a children, for example, I have children and it's around 7 or 8 years age, right? So do you have any benefit for the children to take the iSolution product?
Well, I think that if you take the iSolution program, okay, it might not play the same role as you would when you're an adult, because when you're a child, the body has different requirements, okay? So it means that do we see aging and accelerated aging in children? Absolutely, okay? And how do you see this? This is the first generation that I remember where I actually saw children that were anything from 5 to 15 suffering from type 2 diabetes. I'm not talking about type 1 diabetes. I'm talking about type 2 diabetes, which is lifestyle-induced, dietary-induced, okay? It's caused by inactivity. This generation that is sitting in front of the computer or now the phone, which the phone has become the computer of their lives, and then they spend all their time not exercising, not going out, eating while they're actually watching whatever they watch on the telephone. On you have movies and games and so on. Before it was a game issue, now it's a phone issue. So when you're young like that, you're actually suffering from the consequences of the lifestyle. So you're already showing the signs of accelerated aging. I tell you, we see diabetics, type 2 diabetics, young children that cannot perform basic physical functions because they don't have the muscle mass. Imagine that. They don't have the muscle mass, and they're very obese. Now, in America today, the average 18-year-old is 115 kilograms, right? Imagine this. The average 18-year-old is 115 kilograms. You remember when you go into the lift, and then he says you can accommodate 13 people, 70 kilograms average weight? You remember that? So that's no longer the case. Because in the children in the United States, I see that in Europe, I see it in Australia, okay? Now I'm beginning to see in Asia also. The children are almost double the weight that their same children were, when I was a young boy. So the children have become affected by this, bad lifestyle, no exercise, too much sugar, and so on, and they show it in disease. They show it in accelerated aging. Now, when they're so young, it'd be very difficult to put a young child on a dietary program. But let me tell you that some children, under the supervision of the doctor, will have to be placed on a dietary program, okay? And then in order to do the dietary program effectively, they have to substitute their meals. And I really think, I'm not suggesting that you do it with all the children. I'm saying that those children that under supervision of a health professional have to undergo weight loss, and they have to undergo a significant amount of dietary control, they should be placed on the isolation program. And it would actually be safe for them. There is nothing in the isolation program that is not recommended for children. In other words, if you ask me this question, can children take this program? Absolutely. I mean, children already eat massive amounts of sugar. They already take prefabricated food. They go to McDonald's and they go to fast food outlets. They go all the time. They take sweets full of colors, and that affects their behavior, and full of sugar. And can they not take a product like Iso Solution? Of course they can. But I will say that the process, the program of diet control for 2 weeks should be done under the supervision of a health professional, right? Because children's bodies react differently, and so a health professional should actually look at these children while they're doing that. Okay, and then, but from 18 hours for adults, absolutely, this program is a must.
Okay, so doctor, so more question comes. So the next question is about is ISO product safe? I think for children you already answered safe, right? 100% safe. And also for the people who is in 60 and above, also safe, right?
Right. Oh yeah. Oh yes. I mean, if you look at the combination of the product, the ingredients of the product, every ingredient of this product was designed to work in combination. And I know you might sound to you like a marketing spill, but it's not. That when you put together the product in a combination as they are in the dietary fruit juice, for example, it has a significant amount of fiber, very healthy fiber, which is very important. It has strong antioxidant preparations, okay? Pomegranate extract, fruit juice extract, and it has inulin in it, which is essential for gastrointestinal function. So this product combination are extremely healthy. There's nothing in there that I consider to be of a harmful nature, nothing in there that is considered to be irritating nature, and so on. Of course, like with everything else, you need to make sure that you have no allergies that we don't know, that you understand all your allergies. But if you have any concerns about allergies, for example, just start slowly, and then you'll find out very quickly. But I have never seen that until now yet. So in most cases, the majority of people respond effectively, they respond well, they're very healthy, of course. And then we know from our own research that this program and the ingredients are extremely safe as well. If you're older, it will have certainly no concern. If you're middle age, definitely will be very important, because it will help you to deal with this excess obesity and excess weight, lack of energy, lack of muscle mass, and so on. So altogether, a good program and very safe for all ages.
Okay, so doctor, next question is about also about safe. So whether pregnant women can take ISO product?
Personally, I think, look, a pregnant woman has a special situation in their lives. They're actually procreating, so they have a baby that is growing. They actually need to put weight on, okay? They need to put weight on. They need to do whatever is right for them and for the baby to get through. Now, I don't suggest pregnant women that they go into a 14-day program like that, okay? In other words, I don't suggest any pregnant women that go into a 40-day program to lose weight while they're pregnant. That's a no-no, okay? In fact, women have to be big and fat, and I know that they don't like it, but it's very good for the baby. It's excellent for the baby. The baby needs the extra fat for energy, for production, while it's growing in an incredible rate in 9 months. You have to provide this energy, and the baby will dictate what you need. In fact, they control everything. The baby you're an automatic pilot, right? So your body is an automatic pilot. So I would suggest that do not do a weight loss program unless your doctor is saying to you, hey, you are 150 kilos and you were 60 kilos when you started, so now you have to control weight. Now that's different, right? That's very different. That's a medically regulated weight loss. So I would say that any weight loss has to be consulted with the obstetrician or the doctor that is looking after you while you're pregnant, right? Now, the other question is, what if I'm pregnant and I take dietary fruit juice, because what's in dietary fruit juice? You have antioxidants, excellent for you and the baby. They have fiber, excellent for you and the baby, because often, we find that women that are pregnant suffer from constipation. Okay. And so because of the pressures of the baby, because of the changes in the body mass and then the food that they eat, they become constipated. And so the dietary fruit juice will help greatly, and has nutrition for the mother and the baby. It has fibers, which are actually very healthy for the mother and the baby. And it has inulin, which is very, very healthy for the mother's gastrointestinal system. So altogether, dietary fruit juice on its own, not in a dietary program, but on its own, it will be excellent. Dietary milkshake can be an amazing source of protein. And so sometimes women confess to me that they don't like eating meat because they feel nauseated, right? So they don't like eating meat. And so they can use something like dietary milkshake, but they do not have to diet unless instructed by the doctor, right? So if you take it as an extra complement of protein or extra complement of fiber or nutrients, it's okay, it's good. But remember, if you're pregnant, don't follow a dietary weight loss program unless it's instructed to you by a health professional, right?
Okay, thank you, doctor. So next question, it's about the ingredient inside. So for the iSolution product, will includes vitamin, right? So vitamin is also very important for our skin if we want to start the anti-aging, right?
Right. Yes. Actually, I have to tell you. Let me answer this question also very close to. There was someone asked me. I was trying to read the questions that come through the feed, to the chat room, and then somebody asked the question. Well, senescent cells only in the skin? And I say no. Senescent cells, which is the dying cells, are present in every organ in the body, in the brain, in the lungs, in the heart, in the bones, right? On your muscle cells, everywhere, okay? Absolutely everywhere. Now, these senescent cells are present, and they are the ones that actually triggering and influencing the healthy cells to affect the function of the healthy cells as well. So you have to eliminate them as well. Now, you're asking me about are the vitamins important? Yeah, there are a number of nutrients which are extremely important. And so some of the nutrients includes certain vitamin composition. The most interesting one that I find is the pomegranate extract, is Pomax, right, which is present in dietary fruit juice, which is in fact one of the most significant forms of antioxidants, which has been known to assist in the control of radical free damage, aging control, and also it helps to support cardiovascular function, and it helps to support mental function and brain function as well. So yeah, so there's a lot of important components which actually perform a significant role. But don't forget that the most important source of nutrition in the body is in fact not the food that we eat, is in fact the gastrointestinal system, that in itself, it creates certain vitamins with the food that we take, right? Often the vitamins that we use do not penetrate the body, but they actually use by the gastrointestinal system bacteria to produce other vitamins that we need, right? So the most important control mechanism that we require and support in our daily lives is gastrointestinal function, which the fiber does amazingly well. Inulin restores the quality of the cells of the intestinal system and actually assists in the function of the intestinal system and also in the prevention of diseases as well, in the control of inflammation, in gastrointestinal inflammation. So yeah, so some of the ingredients have important nutritional value, antioxidant value, right? But some of the other ingredients support the central gastrointestinal system mechanism to improve nutrition output into the body, input into the body, right?
Okay, thank you, doctor. So I think next one will be the last question for today.
Okay.
So the question is, do I have to drink ISO milkshake before or after workout? Yeah. So which time we consume take the ISO milk will have more benefits?
Before or after workout? Okay.
Yeah.
Well, I would say that the iSolution, you should follow that program that we promote, which is in fact, for breakfast, mid-morning, lunch, mid-afternoon, dinner, right? Now, I always advise this to you that if you can consume your food, you eat, allow 8 to 9 hours window, which is anything between 9 o'clock, 10 o'clock, 8 o'clock, whatever it is, 10 o'clock to 6 o'clock, okay, 7 o'clock at night. If you do that, you're going to have extra benefits. I'll guarantee you 100%, remember my words, you're going to have amazing benefits, because there is a process which is called intermittent fasting. But this is not intermittent fasting. This is a different process, which you're actually eating, but you're allowing certain time for rest and fasting during the day, every day. So I'm going to discuss this another time when Biswell allows me to talk to you about this topic, because it's very exciting. Now, you asked me the question about where should I take. So I say that you need to program yourself exercise throughout the day. Don't exercise late at night. Now, if you do exercise late at night, try to do it before 9 o'clock. After 9 o'clock is not recommended, because it changes melatonin production in the body. It changes your sleep pattern. Some people say to me, look, I exercise at night. I have to tell you, I used to do it before as well. I feel very tired, so I sleep very well, right? But exercise at night is not totally recommended, okay? So my advice is that if you're going to take the dietary fruit juice and then dietary milkshake, you do it throughout the day at the specific times. The exercise can be placed in between those times. For example, I personally exercise. I start my program at around 10 to 11 in the morning. It means my first meal or my first dietary fruit juice or dietary milkshake is about 11 o'clock in the morning, sometimes 12, personally, myself. And I finish 8 o'clock, okay? But I exercise in the morning before I eat anything, okay? Now, if you exercise while after you eat something, actually people in the past used to say it's not recommended, because doesn't seem to be a benefit to the body. And I will say to you that in fact it actually helps a lot, because it takes the blood away from the intestinal system into muscle for muscle action. So therefore it means that you're not going to absorb as much of the things that you absorb while you eat food, okay? So if you take dietary fruit juice before exercise, okay, you might be able to focus a lot better, because you feel full, and the dietary fruit juice is going to make you full. It's going to give you a sensation of energy. So I would say before exercise would be better, but if you do it after, it would also bring you some benefits. So my recommendation is for dietary fruit juice, you do it before exercise, and for dietary milkshake, you do it after exercise. Okay. So, but if you don't have that flexibility, it doesn't really matter where you do the exercise, before or after. There are benefits to both. But for the dietary fruit juice, I will use it before exercise, and dietary milkshake, I use it after exercise.
Of how to take and how to use the ISO product. Thank you so much for today. Answer all the questions. But today's time is limited, so we cannot answer all of the questions. But never mind, we already take record of all the questions, and we will also send to our product center and also share with Dr. Fernando for the answer. Then we will share back to our branches. So if you have any question which you leave today, but we still cannot answer, no problem. Just contact our branches to get the right answer.
I have one. Can I add one thing, please? I'm sorry to disturb you. I had a question. I was reading some of the question. One of the questions is it safe to take iSolution products after the expiry date? I would say to you that, two questions. It is safe, but it's not recommended, right? So, in other words, let me tell you the truth is that we prefer people to take products that within the expiry date, because that's the function of the expiry date. We have researched the product. We know that within the expiry date, it's adequate, it's functioning. We haven't lost any activity. Like if we say we have vitamin C activity, or we have fiber, or all the activities that are part of the product are still within the tested phase. So we know that this is real and is there. But after the expiry date, we cannot guarantee that. Okay, so there are two parts of that question. Is it safe? Yeah, it is safe. I mean, let me tell you, there are a lot of people use a lot of products, especially food. The expiry date in food doesn't make any sense, because it's not that, oh, here I have milk, expired today, I have to drink it before the end of midnight because tomorrow is going to be bad. This doesn't happen like that, right? The milk will stay good for another 2 months if you treat it properly, another 6 months if you want. Now, some medications are being recycled by pharmaceutical companies that have expired for 1 year or 2 years, and they're brought back into, but for that, they have to do testing, they have to make sure that the product is stable and so on. So my advice is, don't use the product that is expired. But if you do use the product that's expired because you're desperate, you don't have anything, it's going to be safe. But it's not going to provide you what we cannot guarantee, that the level of ingredients is there as we say in the label, right? Thank you, Mr. Chen. Sorry about that.
Yeah, thank you, Doctor. This is also very important. So pay much more attention for the product which is expired. Yeah, okay. So thank you, Doctor, for today's sharing and also for your question answer. So right now you already know the importance about anti-aging. So this product, the isolation product, we have the ISO dietary milkshake and also the ISO dietary fruity juice. This is the golden formula product, which benefits not only for you, but also to your family, also and to your friends. So please stop to try. And also we have the isolation programs, as Dr. Fernando sharing. So we have 14-day program, we have the detoxification program, and we have the maintenance program. So please check for more information from our branches. And right now, I'm going to share you some important messages. It's also about the promotion. Okay, now let me share you this information. Okay, so for now on, we have the iSolution product package. If you buy our 14 days program package, that means you buy 2 boxes of ISO milk and 2 boxes of ISO juice, then you will get 1 box of ISO juice for free. And if you want to have a 28 days program, then you buy 4 boxes of ISO milk and 4 boxes of ISO juice, then you get 2 boxes of ISO juice for free. And also the next is the 15 6-days package. This is for 2-month consumption. Okay, so if you buy 8 boxes of ISO milk and 8 boxes of ISO juice, then you get 2 boxes of ISO juice and 1 box of ISO milk. So it's more than 2 months consumption. Okay, so why are you waiting for? Okay, just contact our branches and to buy and enjoy more. Okay, so this is the package. And also another surprising for you is our iSolution challenge. The iSolution challenge round 1 already finished. Thank you so much for our user from all around the world. So now we start the round 2 from 16 October to 15 November. If you buy our iSolution product, that means you buy a 14 days program, then you take a record, the video record about your healthy lifestyle, and also you are using ISO product, then post to the social media. And then you will have the opportunity to win the free ISO product and also more benefits and more rewards. So please start to enjoy ISO, enjoy the healthy lifestyle, enjoy the anti-aging lifestyle, and also take the record of the video, share to social media. Let more of your friends and your loved ones and see it. Okay, so this is all the surprise we prepare for you. Okay, thank you so much. And also thanks again, Dr. Fernando, for your today's sharing. And in the coming November, we will have more opportunities and also we will invite Dr. Fernando to keep sharing us more information about your body health and also with the iSolution products. Okay, thank you so much. Please just follow beastworld.com for our official website, and also follow our Facebook and also the YouTube and Instagram channels to know more information about Beast World and our products. Okay, Thank you so much, and also waiting to see you soon. Okay, take care and goodbye, everyone.